These are results of our observational study of serial endophthalmitis. We conducted a retrospective analysis of 4 series of endophthalmitis in Ukraine for 20 years from different clinics and different cities. Within the 4 groups, 11, 22, 3, and 24 people were affected. The source of outbreaks in 3 groups was irrigation solution. The data was confirmed by a bacterial laboratory. In the 4th groups, the source of infections was not clear. In 3 outbreaks, the infection agents was gram-negative microorganisms. 2 cases of Pseudomonas aeruginosa, in 1 case, Stenotrophomonas maltophilia. Stenotrophomonas was resistant to all modern antibiotics except sulfametazole and trimethoprim, but fortunately it was pure pathogenic. In 1 case, it was gram-positive Serratia marcescens was found. Within 3 outbreaks, the clinical symptoms have appeared during the first day after operation. In 1 outbreak with Stenotrophomonas maltophilia, vitreous opacity appeared from 6 to 21 days after operation. In 3 outbreaks, the combination management was conducted as following: endovitreal and general antibiotics administration and vitrectomy. In 1 case, only general and endovitreal administration of antibiotics was carried out. In outbreaks with Stenotrophomonas, recurrent vitreous opacity after vitrectomy was occurred. We use repeated vitrectomy with a gas tamponade. 6 patients had 2 operations and 3 patients had 3 operations. In 2 outbreaks with Pseudomonas aeruginosa, the functional results were terrible. Almost all eyes had been blind and enucleations were performed. 1 patient had been operated on both eyes in 1 day and had blindness on both eyes. In 2 different outbreaks, it was possible to restore visual acuity to a high value. But the functional results depended to a large extent on the pathogenicity of the microorganisms. Take-home message: never operate 2 eyes during 1 operation day, even if all instruments are single-use and sterile. If relapse of endophthalmitis occurs, use a repeated vitrectomy with a gas tamponade. Thank you.
I have a comment.
Yeah.
You said do not never operate 2 eyes in the same session.
Both eyes.
Same patient, 2 eyes of the same patient,
Yeah.
of course. There's a large series in Finland, I think, that say that there's no increased risk of endophthalmitis in bilateral simultaneous cataract surgery. And in my practice, sometimes I used to do it, and I feel comfortable with this procedure.
But it may happen once in life, but with Pseudomonas it was terrible.
Why do you want to do bilateral? Less control.
Yeah, the other point was focused on the paper, and that also in bilateral simultaneous cataract surgery, you can achieve the same refractive surgery that you're expected. So sometimes you wait for the second eye to see how is the refraction after the cataract in the first eye. There are some patients that, for issues of time or because they are high myopes and want to go back to work very soon, wants to undergo bilateral simultaneous cataract surgery. I think there's even if an endophthalmitis occur, you have some literature data that can support your procedure.
But there is a question on prophylaxis of this. So my question is, do you take for different procedures the same bottle if this is not empty? And how could the Pseudomonas get access to the irrigation solution? Did you find any reason for that?
For first question, it was, I am not the surgeon in this case, but if the bottle was not open, not finished, they continue operation with the second case. In the second series with Pseudomonas, it was they used 6 bottles for 24 operations.
So the question whether the quality
And,
process of the company is not okay, so that it's not closed, it's something a small slit came in, or whether the handling in the operation room was not properly done.
Maybe, because the Pseudomonas was found only in 1 bottle, but very high concentration. And it is a bottle for preparing all intravitreal manipulations for operation years.
I'm strictly against simultaneous cataract surgery. I remember 2 outbreaks in Germany. One was in Freiburg and one was in Düsseldorf, each with contaminated irrigation solutions. It was not only 1 bottle, it was just a charge of bottles. And they had, in one day, they had an outbreak in the one institution of 12 endophthalmitis cases, and the other one of 15. So no simultaneous cataract surgery for me.